Thank you, Kate, and welcome everybody. Good morning or good afternoon, depending on your time zone. I'm Siobhan Braden, Director of Training and Technical Assistance for the National Center on After-School and Summer Enrichment, and I'm so pleased to welcome you today to our conversation on supporting school-age children in family child care. As Kate was mentioning, this really is designed to be an interactive session. We are really interested in learning from you what's happening in your states, territories, and tribes, what's important to you, and how we can support your work going forward. And I'm pleased to see that we have a variety of different roles joining us today. We have state, territory, and tribal agency staff. We have some family child care providers, center-based child care providers, school-age network and national after-school affiliates. And we also have Office of Child Care, Office of Head Start staff, technical assistance providers, and national child care provider organizations. So we've got a real great range of people. And we also have some others. And I saw people introducing themselves as child care resource and referral, so we should really add that to our list. Thank you again for joining us. Today I have with me Mary Beth Testa, who's from the National Association for Family Child Care, and Michelle Adams from the National Center for Early Childhood Quality Assurance. So they are going to share some information with you today and also ask you some questions. So I think we'll just close the poll now, Kate. Great, thank you. So the goal of NCASE is to ensure that school-age children in families of low income have increased access to after-school and summer learning experiences that contribute to their overall development and academic achievement. We're funded by the Administration for Children and Families as part of a national training and technical assistance system. And we're funded by the Child Care and Development Fund, or CCDF. This network of national centers supports states, territories, and tribes in implementing the CCDF to provide low-income families who are working or participating in training with help paying for child care. And as we've been starting up this center in the past year, we've been learning that quite a few children in family child care are school age. So I'm going to share some statistics with you about that. Of course, the Administration for Children and Families believes strongly that family child care is a critical component of the national child care system. And the Child Care and Development Fund, or CCDF, supports 27% of school-age children who are enrolled in family child care, which is 1 in 4 of all children supported by CCDF. So you can see why our national center, with our focus on after school, believes that this is a really important issue for us and is really interested in learning how we can support your work. So the goals of our session today are to discuss some of the benefits and challenges of family child care and to explore with you challenges and strategies around supporting providers of school-age or mixed-group family child care, and to provide input to inform future technical assistance offerings and resources. So that's where you come in. So what is family child care? Family child care is the work of child care provided in a professional caregiver's home. And family child care providers enroll children from birth through school age. The Administration for Children and Families has some definitions for licensed home-based care and license-exempt home-based care. I'm not going to go through them in detail right now, but every state, territory, or tribe has regulations around child care, and frequently there are different regulations for family child care. And in many states, that depends on the number of children that are served and the relationship between the provider and the children. There are also many license-exempt home-based or family child care providers, and again, that's tied to a threshold number of children, and in some cases, if the child in care is related to the provider. Again, it's quite variable across states, territories, and tribes. And now I'd like to introduce my colleague, Mary Beth Testa, who is with the National Association for Family Child Care. And Mary Beth is going to share with us some information and some provider perspectives. Mary Beth?
Thank you so much, Siobhan, and thank you everyone for being here today and for the opportunity to talk with you. The National Association for Family Child Care promotes the power of family child care through standards and accreditation, advocacy, and professional development. NAFCC is the voice of family child care providers. There are some 1 million paid providers in home-based settings in this country. There's 3 million children in family child care. They're out there having an experience from birth through school age, like Siobhan said. We're enrolling infants, toddlers, preschoolers, and school-age children. CCDBG is a priority for NAFCC. I'm going to pause there. I use CCDBG and CCDF interchangeably on this slide, which I shouldn't do, and from here forward we'll stop doing. But just to clarify, the Child Care and Development Block Grant is the law that authorizes the Child Care and Development Fund. CCDBG is what Congress deals with, and CCDF is the work of the Department of Health and Human Services through the Administration for Children and Families and the Office of Child Care. It's also more likely the terminology that our state agency leaders use via the CCDF state plan and other experiences with the law and the fund. So with apologies, CCDBG is a priority for NAFCC. It presents both an opportunity and a challenge, both as we've been experiencing it for the last 18 or 20 years, and then with the new reauthorization. We've got priorities in the law and in the regulation to build the supply of high-quality family child care. 45% of children served monthly through CCDF are school age. 24% of children in CCDF-funded care are in family child care. These is not an insignificant population here. 27% of school-age children are in family child care settings during out-of-school time. And across birth to 12 in CCDBG, together we're all navigating licensure, quality initiatives, accessibility and affordability, professional development, and qualifications. And what I mean there is that this is a birth to 5 conversation. This is also a school age conversation, and on many of the same hurdles, both opportunities and challenges. We believe that family child care is a solution to challenges that we're facing for families and in the states. When we talk about building the supply, and we got to think about what it would mean for families. Well, by building the supply of high-quality family child care, it would mean meeting the needs of rural families. It would mean meeting the needs of families seeking infant and toddler care, and also out-of-school time care for their older children, meeting the needs of families that work non-traditional hours or ever-changing shifts. It means access to cultural and linguistic competence in your child care provider and in your family's relationship with him or her. And it also means increasing parent choice among high-quality options for families. And Kate, we've got a quick poll. That's our perspective on how family child care meets families' needs. For those on the call, what are your top 3 needs met by family child care? For the family child care providers on the call, please answer from your own perspective. What are the top 3 needs that you meet? And state agency leaders in resource and referral and others maybe answer based on what you see in your state and community. Great. We've got a lot of response on non-traditional hours and those ever-changing shifts. A lot of response on infant care. It's key in the rural areas and that family choice, right? Great. Thank you, everybody. Kate, I think we've got some great answers there. Thank you, everybody. So we canvassed NAFCC members to get the latest thoughts on mixed age groups and school-age children in their programs. And here's what they told us. We heard opportunities like continuity of care. It's something we talk about a lot for young children. And in a family child care setting, that can be across the years and not just one age year of that child. We heard from providers who said, I've got school-age kids that have been here since they were babies. Another opportunity is keeping siblings together, scaffolding learning opportunities. We heard about the older children getting to be role models and peer models and learning the importance of setting a good example. We also heard that younger children learn from the older children, and we heard that sometimes this is a challenge as well as an opportunity. We also asked them about what was tough about mixed ages, what was challenging about school-age children, as well as your babies, toddlers, and preschoolers. I thought it was important to note that we heard both challenging and challenging but rewarding to do this work and to try to do this work. We heard programmatic challenges like finding developmentally appropriate practices for mixed ages and engaging multiple ages at the same time. We heard that supervision and group management of older children and younger children with different caregiving needs all at the same time can be challenging. We heard challenges about staffing, and maybe that was related to the school bus stop pickups or other arrival and departure transitions, or related to different numbers of children at different times of day, and the compensation issues and the feasibility of additional staffing for certain times of day. We heard about access and affordability, which is the conversation we're having about child care overall. Providers having to ask parents to pay for a full-time slot because the provider can't afford to hold that slot just for part of the day, and the costs and accessibility of transportation from between school and that family child care home. We also heard some challenges with ratios, meeting requirements for all age groups, and passing the family child care rating scale, how to navigate a quality rating system with mixed ages that might have different priorities for different ways or different scorings for different ways. And we had some conversations about professional development and the portability of credentials and degrees for early childhood and school-age workforce when we compartmentalize our funding streams and are thinking about different age groups and what the workforce needs to know and be able to do. When that all comes together in a family child care home, we have to figure out how to navigate that.
Thank you so much, Mary Beth. And before we go on to Michelle, I'd just like to ask if there are any comments or questions that people would like to type into the chat box based on what you've heard from Mary Beth and maybe from some of the poll responses that you saw, if it was in line with your experience or maybe different. So I'm just going to pause here for a minute to do that, and then we'll move on to the next portion. You'll have plenty of opportunities to weigh in throughout this offering. Okay, then I'm going to get started with introducing Michelle Adams, who's with National Center on Early Childhood Quality Assurance, which is part of the Training and Technical Assistance Network that I referenced earlier in our call. And Michelle is going to share what she's been learning about school-age and mixed-age group family child care from participants in a family child care peer learning community that she's been running. Michelle?
Thanks, Siobhan, for the opportunity to share information about our peer learning groups. We have 12 teams representing 10 states that are participating in the peer learning group on supporting continuous quality improvement in family child care. These teams, they submitted applications to participate in our learning groups, And they were accepted based on a cross-sector representation of the team members, but also based on their goals for strengthening relationship-based early learning experiences for children in the family child care environment through staffed family child care networks or collaborative partnership support systems in their community, state, territory, or tribe. Our teams included state administrators, child care resource and referral agencies, community colleges, and even some family child care providers. So I'm real pleased to have the opportunity to share this information. We asked our learning group participants to respond to this question about challenges. Yes, thank you. To the question about challenges associated with serving mixed age groups and school-age children. And we learned from our participants that, as you all may well know, it takes time and skill to be able to multitask to assist the younger children while monitoring the older children, and all the while making the learning experience receptive to all the children in care. In addition to the challenges with balancing the activities for the children of different ages, our participants noticed that there must be a wide range of materials available to meet the needs of each individual child and also provide a continuous progression of learning. However, they did indicate that there is a general lack of age-appropriate materials and equipment for children for school-agers. Our participants in the learning group also noted that providers have challenges in arranging the space in their home where after-schoolers can have an opportunity to focus on their homework without distractions. And some providers also lack a knowledge of what the school-age children are learning in school, and so they're not able to really assist school-age children with homework, which is oftentimes a request that they get from parents. Summer learning loss for school-age children was also identified as an issue. Providers don't really have the ability or the access to resources to help with the prevention of summer learning loss. And there's also a lack of readily available solid school-age curriculum, especially linguistically appropriate curriculum, available for providers. Other participants noted challenges with transitioning and transporting children. I think that was one that Mary Beth noted. It's really difficult for providers to secure additional caregivers to meet ratios during those limited transition periods before and after school. Now, we'd like to hear from you in this next poll. If you could indicate what challenges family child care providers serving school-age or mixed-age groups are facing in your local community, state, territory, or tribe. Type in your answers there.
Thanks, Michelle. And also, as Mary Beth suggested before, if you are a provider, please answer for yourself.
Looks like we've got some great answers there and some similarities to the information that we found out from our peer learning groups as well. It looks like you all are noting transportation, which was a challenge that the peer learning participants noted, as well as age-appropriate activities and lack of curriculum and training, and certainly finding the appropriate space for quiet time for homework. Okay, very good. Thank you. And We've got a nice response there, Kate. We'll go ahead and close the poll when you're ready. Okay, we asked our learning group participants also to identify specific strategies and supports that they identified or that they offer for family child care providers serving school-age children or mixed age groups. And our learning group participants indicated that during their home visits, network staff would inform providers of resources that they have available within their communities, particularly training resources. Some of our participants indicated that they offer a monthly themed kit that provides developmentally appropriate lesson plans and ideas for caregivers, which also includes guidelines for simplifying and extending the activity for younger and older children. One network sends emails with resource links specifically addressing school-age or mixed-age group planning, and also training resources, which do include the Better Kid Care online educational outreach program from the Penn State Cooperative Extension Service. Now, these training modules through Better Kid Care were developed originally for Pennsylvania family child care providers, but they're now online courses and available to all family child care providers nationwide. There were 3 participants identified that specifically addressed school-age or mixed-age care. Those 3 were caring for groups of mixed-age children. It's a juggling act. It's a self-learning module. And then child care for mixed ages, self-learning module for Better Kid Care, and family child care mixed ages, a second self-learning module. So we'd like to, again, hear from you about strategies or specific supports that you put into place for your family child care providers serving school-age children. If you would, again, type in your responses, and if you're a provider responding to the poll, please answer based on your individual perspective.
And Michelle, while people are doing the poll, there was a comment in the chat box that was related to the challenges, specifically that the school system used to provide bus transportation to homes, but it doesn't anymore in this location. So providers and parents are trying to find transportation alternatives. So that definitely adds on to the transportation challenge trend that we heard about.
I'll take that back to our peer learning group and see if they have any additional supports that they've identified for that challenge. It looks like we have some good responses here regarding training. It looks like one group has a specialist for school-age training. That's great. I'm not sure what the Trails van is. That's a good one. I'll have to look that one up.
Could the person who put the Trails van in please put in the chat box what that is, because it sounds interesting.
Mm-hmm.
Oh, and I noticed that similar to what you mentioned from one of your states, Michelle, there's the reference to trainings and materials provided, toy and book lending library for activities.
Mm.
So we're certainly seeing a lot about training provided by resource and referral, some face-to-face and some distance. Right, weekend and evening training so that it's available to, so that family child care providers can attend, so that it's a convenient time for them, because during the typical workday, they're working with the children. So that also sounds like a really good strategy. Oh, and another state mentioned school-age specialists as well.
Oh, the Trails van is a traveling resource library. Oh, that's a great.
Oh, nice.
Thank you for sharing that. Okay, it looks like we've got some great responses there.
Okay, well, thank you so much, Michelle. Appreciate you sharing what you heard from your peer learning community participants, and it sounds like you have a good representation. I think you said 10 states and people in a variety of different roles, so it's interesting to hear what they had to say and then to also hear from our participants here today. There were definitely some common threads.
Right, and I'll be sure to take what I learned today back to our next peer learning group meeting.
Thank you, Michelle, and thanks to everybody for responding. What I'd like to do now is share some resources that are relevant to family child care for school age and mixed group that are on the Office of Child Care website. None of them is focused specifically on school age or mixed age group because we know, well, with the exception of, no, none of them are focused specifically on that. However, they do have useful and relevant information because we know that school age is part of the system, part of a bigger system. Going forward, we're interested in learning about existing resources that you can share with us, and we're also interested in identifying ways in which we can support the work of states, territories, and tribes going forward to support family child care for school age and mixed age groups. So now we'd like to hear from you about which topics would be of the most interest to you. We also are interested in supporting providers, of course. So our primary audience is at the state, territory, and tribal system level. Of course, we're interested in supporting providers as well. So we'd love to hear from you about the topics that are of most interest to you as we look at identifying and developing resources and also technical assistance offerings. So we're going to take a couple of minutes to see what people are typing in there. And not surprisingly, the current lead is developmentally appropriate curriculum, which is what we heard as a challenge for providers around school age and mixed age groups. So that's definitely coming up high. Inclusion of family child care and school age and quality improvement systems is also coming up high on the list, along with workforce development and supervision, group management for mixed age groups, and business practices for providers. So Kate, are people seeing these results?
They are.
They are, great, okay. So you're all seeing that. Okay, so the winner is developmentally appropriate curriculum. It seems like there's interest in many of these topics. And so that's really helpful for us as we go back to our technical assistance system, both within our center and also collaboratively working with other centers. So now I'm interested to hear from people in the chat box if there are any comments or questions or resource suggestions that you might have for us that we might not be aware of, because we know that states and territories and tribes sometimes develop their own resources and others might not know about them. So we'd love to hear about it. And please type it in there. And I think Kate's going to remind people how to unmute if you would like to talk.
Yeah, if you would like to share a comment or a resource, you can hit *6 on your phone if you've joined via the phone line to share. Otherwise, I know many of you are listening via your computer. Please use the chat box there to share your comments, questions, and ideas.
Okay, so Tricia Haynes shared that Trails vans are run through the Child Care Resource and Referral in West Virginia, And along with resources, they're staffed with personnel who will offer on-site TA and professional development. That's great, Tricia. Thank you for sharing that. And Amina Hilton shared Funshine Online. So it definitely sounds fun and interesting. We'll definitely need to look into that. Can Amina, if you can unmute yourself, do you want to say a little more about that, or just type in what kind of a resource that is? Is it around developmentally appropriate materials and curriculum? Is it something different? And also, if others that are on the phone want to unmute themselves and share, you can just press *6. I see a couple of people are typing. And as I reflect on the conversation that we've been having today in the polls, not surprisingly, there's a lot of alignment on amongst what Mary Beth heard from providers and what Michelle heard from her participants, who were more at the state, territory, and tribal level, and also child care resource and referral agencies, and what you all shared with us around your challenges and your support. So that's good. That's what we hoped. And so we're clearly all on the same page with this, and now the next step is really figuring out how we can support you with the work going forward. Okay, we're getting some other suggestions which we can, let's see, so people can look into the chat. Let's see, Khan Academy Online assists with homework and tutoring, and it's free. Yes, I was going to say free is good for resources that we're recommending here as a federally funded center. So, okay, and Funshine is a curriculum planning site. Great, okay. The Ivy says that the NE dedicates a monthly newsletter for family child care that includes tips, trends, PD, and TA opportunities. That's great, Ivy. And the Indiana Child Care Resource and Referral offers TA and trainings through school-age specialists. And then there's another vote there for somebody that has found Khan Academy to be useful. So that's great. Thank you. We'd like to share with you our newly launched resource library that, as Kate mentioned, I believe at the beginning of the call, we launched it in August. We were working on gathering resources, so we launched our first iteration of it in August, and we are very excited about it. We're going to continually add resources, and that's also one of the reasons that we're interested in hearing from you about resources. It is focused on out-of-school time, of course, because that's what we focus on here. And for out-of-school, we use out-of-school time interchangeably with after-school and summer enrichment. So it's times when school-age children are in care that's not during the regular school day. So we kind of use those terms interchangeably, and you'll see that if you go to the resource library. It's a great compendium of out-of-school time resources that have been created by other organizations that can be really useful to anybody working with school-age children or at the state level working on strategies and supports and systems that include school age. So there's a link to it here, and Kate has also put it below if people want to take a look. And I think Mary Beth was going to share something about their upcoming conference. And she just did. Thanks, Mary Beth. So the National Association for Family Child Care Conference for 2017 will be July 19th to 22nd in Mobile, Alabama. And it's a great time to engage with family child care and to connect with one another as child care resource and referral and state agency staff. So thank you, Mary Beth, for that information that people can mark on their calendars. Oh, and somebody says that the NAFCC conference is awesome. That's great. Well, we really appreciate everybody taking the time to join us today and sharing your input. So before we close, I'd like to see if there are any additional comments, questions, or resource suggestions either by unmuting yourself with *6 or by typing into the chat box. Okay, well, thank you so much for joining us. We really appreciate it. As Kate said, the recording and materials from this session will be posted on our section of the Office of Child Care Technical Assistance website. There's also a quick survey about this webinar that we'd love to have you complete that will pop up in a minute unless you have pop-up blockers on. If you do, then we'll send you a reminder. So thank you so much, everybody, and really appreciate your time and sharing of your resources and helping us learn more about how we can support you in the coming year. Thank you. Goodbye.